All right, guys. Now, before I get started here, I just want to let you know that this isn't going to be a very extensive overview of, how the kidneys work to maintain our bicarbonate balance, or how the lungs, work to maintain the CO2. This is going to just help you understand how to calculate ABGs and how to determine what a set of ABGs would indicate. To give you a little bit of information here, our normal values for pH are 7.35 to 7.45. Our normal values for CO2 are 35 to 45. I know it's backwards, but don't let that confuse you. You'll understand once we get started. And our HCO3, which is bicarbonate, the normal range is 22 to 26. An easy way to remember these normal values, and you're going to need to know them: pH, 7.35 to 7.45. CO2 is essentially the same. It would be 35 to 45. Again, don't let the fact that it's backward confuse you. And then HCO3 is 22 to 26. You'll just have to remember that one. Anything below 7.35 is considered acidotic or acidosis. Anything above 7.45 for pH is considered alkalinic, or which is essentially basic. That's why we have it color coordinated: acidosis, acid, alkalosis, basic. CO2, if it's respiratory acidosis or respiratory alkalosis, you can understand that it's involving the lungs. And metabolic, whether it's metabolic acidosis or metabolic alkalosis, it's involving the kidneys, which is regulating the HCO3 or bicarbonate. And anything in between 7.35 and 7.45, or 45 and 35, 22, 26, anything in between, we can consider normal. So whenever we approach these questions, we're going to use this basic tic-tac-toe grid, and you may have heard it called ABG tic-tac-toe before. We're going to use this grid and the given information to determine whether our patient has acidosis or alkalosis, and whether it's respiratory or metabolic. And after we do a couple problems, we'll even get into a little more complexity involving compensation, and I'll explain as we get into it. But today I have about 9 questions for you, and it's going to cover every kind of example that you could get on an ABG type question. And I hope this helped, guys. Let's get started. So for our first example, we're going to go our pH that we're given, 7.31. Our CO2 is 49. And our HCO3 or bicarbonate is 24. So here's how we use this. Whenever you approach an ABG question, the very first thing that you need to look at is your pH. Your pH is going to tell you right off the bat whether you're looking at acidosis or alkalosis. So let's look at our pH, 7.31. Always just start on your left column. Oh, and by the way, take a picture of this, write this down. This table is going to help you immensely. All right, 7.31. Is 7.31 less than 7.35? Yes, it is. So immediately you know that you have acidosis. So let's go ahead and write that down. And since pH falls underneath our acidosis column, let's put pH under our acid column down here. Let's go to CO2. CO2 is 49. Is 49 greater than 45? Yes, it is. So let's put, since CO2 is falling under our acidosis, let's put CO2 under our acid column. And finally, our HCO3 of 24. 24 is not less than 22, and 24 is not greater than 26. It's in between, therefore it's normal. So since HCO3 falls in the normal column, let's write it down here in the normal column. Now, we have all of our information necessary to answer the ABG question. Here's how you do it. Basically, whatever falls in the same column as the pH tells you what the cause of the acidosis is. So, for example, the pH is underneath the acid column, so we know we have acidosis. The CO2 is also under the acid column with pH. Therefore, CO2 is respiratory. What we have is respiratory acidosis. Now, if pH was over here in the basic column, for example, if this question were different and it were over here, whatever would fall in this box in the same column as pH would be the cause of the problem. Let's move on to the next question, give you another example, help you get a better understanding of this concept. All right, guys, question number 2. What we have is a pH of 7.5, a CO2 of 37, and an HCO3 or bicarbonate of 29. Now, remember, the first thing that we need to look at is the pH. The pH tells us right off the bat whether we have acidosis or alkalosis. So 7.5 is greater than 7.45. Therefore, we know we have alkalosis. And because pH is falling underneath the alkalosis column, let's write it down here. Next, let's take a look at our CO2, 37. 37 is not greater than 45, and 37 is not less than 35. Therefore, it's in between. That means it's normal. So let's write our CO2 in the normal column. And finally, HCO3 is 29. 29 is greater than 26. Therefore, it falls in the basic column. So let's write it down here in the basic column. Now, in this example, our HCO3 is in the same column as pH. Therefore, we know that the HCO3 is the cause of our pH problem. In this example, we are alkalinic. And HCO3 refers to metabolic. So we know we have metabolic alkalosis. Let's move on to the third question. Now, before we get started on this third question, let's try and remember that while on pen and paper, this is an ABG question and it's, regarding ABG results, let's remember that this applies to a patient. So let's not just look at it as, oh, it's respiratory acidosis or, oh, it's metabolic alkalosis. Let's apply it to the patient. So let's do that on this next question. So for this one, we have a pH of 7.6, a CO2 of 21, and a bicarbonate of 22. Now our pH, 7.6, is greater than 7.45. So we know off the bat we have alkalosis. And since pH 7.6 is falling in the basic category, let's write it down here in the basic category as well. Next, a CO2 of 21, that is most definitely less than 35. So since it's falling in the basic category, let's write it down here in the basic category. All right, and our bicarbonate of 22, 22 is not less than 22. Therefore, it is normal, and we will write it in the normal block, normal column. And since CO2 is in the same column as pH, CO2 has to be the cause of our pH problem. CO2 is respiratory, therefore we have respiratory alkalosis. Essentially what's happening in our patient, let's refer to the patient now. This would probably be a patient, and the best example that is always given is your patient who comes in maybe having a panic attack, very, anxiety, and they're hyperventilating. Whenever you hyperventilate, think, ha, 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 ha. You're breathing at such a rapid rate, your respiratory rate's through the roof. You're constantly blowing out CO2. And whenever you lose CO2, you put yourself in an alkalinic state. That's why it's respiratory alkalosis. And, if you hyperventilate and you lose the CO2, it affects the pH of your blood. That's why it's so important to take this ABG information and not just look at it as numbers on a piece of paper, but refer it back to your patient. All right, guys, before we move on to question 4, make sure you don't stop this video right now and think that you have a good grasp on what ABGs are, because right now I'm kind of just laying the foundation. Here in a moment, we're going to get into some more complex problems that you definitely want to stick around for. It's the fun stuff, and it's the stuff that you're going to need to know whenever you get tested on these exams. So question number 4, we have a pH of 7.15. We have a CO2 level of 44, and we have a bicarbonate level of 19. So as always, begin with pH. 7.15 is most definitely lower than 7.35. Therefore, right off the bat, we know already that what we have is acidosis. Because the pH is falling underneath the acidosis column, let's write it down here underneath the acidosis column. Next, our CO2 of 44 is not greater than 45, and it is not less than 35. It's in between, therefore we know it's normal, so we're going to write it in the normal column, CO2. Finally, our bicarbonate of 19 is less than 22. Therefore, and it's in the acid column, let's write it down here in the acid column. And now, because we know HCO3 is in the same column as pH, that means that HCO3 is the problem causing the pH problem. And since HCO3 is metabolic, we know what we have is metabolic acidosis. Now, if we relate this to our patient, basically what would be occurring with our patient, maybe some acute form of renal failure, whatever it might be. Basically, the kidneys, since the kidneys deal with metabolic, the patient's kidneys would be excreting too much HCO3. It would be, putting it out in urine, getting rid of it from the body. And we know that HCO3 bicarbonate is the main buffer of the body. The bicarbonate attaches or bonds with the free hydrogen ions in order to keep the blood pH between 7.35 and 7.45. If the body is getting rid of bicarbonate, that means that there are more free hydrogen ions, and these hydrogen ions reduce the pH, as we can see, and we call it metabolic acidosis because the kidneys are the cause of the problem, not the lungs. So continue to try and keep the patient in the back of your mind as you're doing these ABGs, and again, not just think of it as numbers on a piece of paper. Now for this next one, what I want you guys to do after I give you the question information, I want you to pause the video and try and do it yourself. And whenever you're done, go ahead and press play and see if you got it right. For this one right here, this is question number 5. What we have is a pH of 7.45. We have a CO2 level of 36, and we have a bicarbonate level of 25. Go ahead and press pause and come back in 2 seconds, and let's see if you got it right. All right, so first things first, let's look at the pH, 7.45. 7.45 is not greater than 7.45, so it's in between these two, therefore it is normal. So we're going to write the pH in the normal block. Now, before even going any further, you wouldn't have to, because if the pH is normal, that means that we don't have an acidosis or alkalosis problem. The pH is fine in this patient, and that's exactly what we want to be the case. But let's go ahead and look through these last two and see if that proves to be correct. A CO2 of 36 is in between 35 and 45, therefore it's normal. So we will write our CO2 in the normal column. And our bicarbonate of 25 is in between 22 and 26, indicating that it is normal and our patient is not having any blood pH issues. And this is what we want to see in our patients, a healthy, normal ABG value. So over here, we'll just write normal or no problem, whatever you want to write. All right, guys, now we're about to get into the complex problems. This is the fun stuff. This is the stuff that you need to know in order to get correct answers on your nursing exams, whatever kind of exams you might be, that they're going to give you ABG values. And I'll try my best to explain it to you, break it down into simple terms so that you can understand. So for our first problem, or technically our sixth problem here, we have a pH of 7.47. We have a CO2 level of 26, and we have a bicarbonate level of 19. As always, let's approach it the same way. pH, check it first, 7.47. That is above 7.45. So right off the bat, we have alkalosis. Since pH is in the basic column, let's write it down here in the basic column. Next, our CO2 of 26. 26 is less than 35. So we're going to write this CO2 in the basic column as well. And next, our HCO3 of 19 is less than 22. So since the HCO3 is falling in the acidosis column, let's write it over here in the acid column. Now we haven't seen this before, so let's try and understand what this means. I've been saying that whatever falls in the same column as the pH is the cause of our pH problem. So what we know, CO2 is in the same column as pH. This is the same concept that we've been learning. CO2 is respiratory. So what we have is respiratory alkalosis. But we're not finished, okay? We have this HCO3 over here, and it's not in the normal column like we've been seeing. So what does that mean? All right, what we have here is respiratory alkalosis. Basically, like I said before, you have the hyperventilating patient. They're expelling a whole bunch of CO2, and that's affecting the blood pH. You've got a higher than normal blood pH. So what does your body do? Your body is this very wonderful, unique organism that tries its best to maintain homeostasis, because a pH that is outside of the normal ranges can be very deadly. It's a very serious problem. So what happens? What your kidneys do, your kidneys try and compensate. That's the word that we're going to use. They try and compensate for this pH imbalance. And what they do in this particular example for respiratory alkalosis is basically the body is going to excrete more bicarbonate from the body in the form of urine. That way there's less bicarbonate to bind to free hydrogen ions. That way there are more free hydrogen ions. And what do hydrogen ions do? They lower the pH of the blood. And that's exactly what we want to have happen, because right now our pH is a little high. So the body, the kidneys, get rid of bicarbonate, allowing for more free hydrogen ions to try and counteract or compensate for this high pH value. So what we call this, and what you will call it on your tests, is partially compensated respiratory alkalosis. Let's move on to the next question and give you a better understanding of these complex problems. All right, guys, let's move on to our next question. This is number 7. We have a pH of 7.34, a CO2 level of 30, and a bicarbonate level of 20. Start with the pH, 7.34. It's just below 7.35, but it is still below. Therefore, we have acidosis. And since the pH is in the acidosis column, we write it down here in the acidosis column. Next, our CO2 of 30. That is below 35. It's in the basic column. Let's write it down here in the basic column, CO2. And our bicarbonate of 20, that's less than 22, acid column. We write it here in the acid column. HCO3 is in the same column as pH. So HCO3 is the cause of our pH problem. HCO3 is metabolic. So we have metabolic acidosis. Our CO2 is not normal. It's over here in the basic column. And essentially what you can think is that anytime when you have your little tic-tac-toe grid, if you have a value that is on the opposite side of your pH and your causative problem, you can automatically think it's partially compensated. All right, guys, we got 2 more questions for you here. Let's move on to question number 8. What we're given is a pH of 7.23, a CO2 level of 61. Now, if that doesn't catch your eye immediately after all these problems we've done, something's wrong. And we have a bicarbonate level of 40. That too should catch your eye. All right, first, 7.23. Definitely below 7.35, so we know already. And since it's in the acidosis column, we're going to write pH here in the acidosis column. CO2 of 61, way above 45. So CO2 goes in our acid column. And our HCO3 of 40, way above 26 in our basic column. So let's write HCO3 over here in our basic column. CO2 is in the same column as pH, therefore CO2 is the cause of our pH problem, making it a respiratory issue, respiratory acidosis. HCO3 is on the other side of our pH and our causative problem, so we know already that it's partially compensated. What I don't want you to do is get in the habit of saying, okay, well, this is on the other side, so I already know it's partially compensated. I mean, yeah, that's true, but again, really understand why. What is actually occurring and why it's compensated. It's very important. This could be your patient that has COPD or asthma, basically where their airways are constricting and they're having trouble getting oxygen in, but they're really having problems getting CO2 out of their body. So CO2 is building up and it's causing the pH to drop. Big problem. So that's the cause. That's why it's respiratory acidosis. And then what do your kidneys do as a result to try and compensate? They're going to retain a whole bunch of bicarbonate, as opposed to before where we see the kidneys are pumping it out of the body in the form of urine. Here, the kidneys are going to make sure to reabsorb this bicarbonate in order to bind with the free hydrogen ions and try and raise the pH from the acidotic state back to homeostatic levels. And last but not least, our final example here, what we are given is a pH of 7.53, a CO2 of 5.3, and an HCO3 of 5.3. Now, don't get this problem and look at it and be like, oh my God, that's so confusing. There's so many 53s. Just go through the process and do what you know. 7.53 above 7.45, immediately we know it's alkalosis. Don't let these problems confuse you. Stick to what you know. That's why it's so important to practice. Practice makes perfect, y'all. Since pH is in the alkalosis column, we're going to write it down here in our basic column, alkalosis column. CO2 of 53, definitely above 45. Since that's in the acid column, let's write our CO2 down here in our acid column. And our bicarbonate of 53, way above 26 in our basic column. So we write it down here in our basic column. HCO3 in the same column as pH, therefore that's the cause of the pH problem. HCO3 is metabolic, so we know we have metabolic acidosis. Over here, we see CO2 is way on the other side. It's not in the normal, so we already know it's partially compensated. But why? Well, guys, that was it. That was ABG's Made Easy with your boy Nurse Bass. I hope that this was helpful. I hope you could take away something from it. Take this information, take this knowledge, watch this video again whenever you need to brush up on your ABG knowledge, and take this and go rock out those ABG questions that they're going to give you on those exams. If you enjoyed the video, leave a comment down below. Let me know what you liked about it. Let me know what you didn't like. If you didn't, like, subscribe, stay tuned for more videos. It's your boy Nurse Bass, soon to be, and I'll catch y'all in the next one. Peace.